and how to do for some physical examination. So that it needs to be integrated from the year 1, year 2, year 3, and before you come to year 4 and year 5. So some clinical skills you can pick up. Okay, we will see how we can go about it. Continue.
Okay, so the doctor and patient can start now.
Okay. Who is going to ask me, or who is the person interrogating?
Me, doctor.
What's your name?
Mukmin.
Okay. Yeah.
Okay,
Start.
and I'm Balkis, doctor. I'm going to be the patient for today.
Okay. Yeah, you can start.
All right. Thank you, doctor. Okay, Assalamualaikum and hi. My name is Mukmin. I'm a second year medical student from University of Cyberjaya. May I know your name and your age, please?
Waalaikumsalam, doctor. My name is Balkis. And I am 62 years old.
All right. Nice to meet you, Miss Balkis. So, may I know
But
why you
here,
come here?
wait a minute. They give me history, the male 65 year. Ex-army officer. Is it the same case or a different case?
Come again, doctor.
Here, what they gave me is a male patient 65. Is it the same patient or different patient?
Yes, it's a male ex-army doctor, but then the person who came to complain is his wife.
Oh, you are taking history from the wife. Okay. Okay. Yeah, tell me that one. I thought you're talking to the patient is unconscious or cannot talk. So you first tell you're taking history from the wife of the patient. Okay, go ahead.
All right. I'll start over again. Assalamualaikum and hi. My name is Mukmin. I'm a second year medical student from the University of Cyberjaya. May I know your name and your age, please?
My name is Balkis. I am 62 years old. I am the wife.
All right. Nice to meet you, Miss Balkis. May I know what's been bothering you and why you come here?
So, doctor, I came here because I need your help. My husband cannot move his hand and leg.
All right, I see. So I'm gonna ask you a bit of questions, and while I'm asking, I'm gonna write on my notes if that's okay with you.
Sure, doctor.
All right. So you are saying that your husband cannot move his hand and legs, right? Can you elaborate more on that? What's been going on?
So, my husband cannot move his right hand and leg. It just happened 1 hour ago, and we brought him here as quickly as we can.
Okay, I see. Is it exactly 1 hour ago or approximately 1 hour ago? 1 hour ago.
Approximately 1 hour ago.
Approximately.
Yes.
All right. Is it on both sides or just one side?
It's on the right side, doctor.
Right side for both hand and legs, is it?
Yes, doctor.
All right. How severe is that? Can he like hold anything with his hand or standing with his leg?
So,
Of his own?
for the severity, even when he need to walk, he need my help because he could not even stand. And for the hand, I tried to give him some water, but he could not hold the cup either. That is really bad.
Okay, I see. That was pretty bad. Okay. So I want to ask him about does he have anything for any associated symptoms. So does he complain anything about headache or nausea before he's getting like this?
I wouldn't say nausea, but uh, um, he doesn't seem to understand when I tell him, and he never replies. He just stares at me.
Okay, I see. What do you mean by not understand? How comes you not? Does he look confused or something?
Yes, doctor. I'm not very sure if he is confused, but I think he is confused because he could not speak at all.
Okay. So you think that he is confused and he also cannot say anything, right?
Yes, doctor. He could not
Uh,
speak.
okay. Does he experience vomiting before? Any vomiting?
No, doctor.
No. Okay. Any abnormal vision? Does he complain anything about that?
There's no abnormal vision.
Okay. Do you notice anything changing in his behavior?
Um, I think his face looks twisted. It's quite frightening.
So nothing abnormal about his behavior, but uh,
No,
his
doctor.
face look twisted lah.
Yes.
Okay. Do you notice anything about anything? Do you notice any of his muscles twitching or shaking?
I did not see any abnormal twitching or shaking at all.
Okay. Um,
Yeah.
all right. Um, does he became unconscious before he came here?
He never lost his consciousness.
So he conscious all the time for the
Yes.
period of 1 hour. Okay. Does he seems like grasping grasping for air or any breathlessness?
No breathlessness.
No. All right. Um, okay. So I want to ask a bit more about his medical background. Um, does he been hospitalized before?
Um, he he never had been hospitalized before, doctor.
All right. He's never been hospitalized. Does he have any chronic illness like hypertension, diabetes?
He will have some headache once in a while, and it is sometimes bad. So at some point, I think he told me that his doctor said he had high blood pressure.
Okay. His doctor said, which means
He
he
told
met
me,
doctor before.
yes.
He met doctor before. When is it?
I think about 5 to 6 years ago, his doctor told him that he had high BP.
Oh, okay, I see. So it was a long time ago lah. Does the doctor prescribe anything? Did he give any medication?
He stopped his BP medication many months ago. Doctor.
Do you know what medication is that?
BP, blood pressure, high blood pressure.
Uh, okay. Do you know anything about his cholesterol level? No?
No, doctor. I
No.
think he never checked that because he never told me anything about it.
Okay, I see. Uh, any diabetes?
There's no diabetes.
Diabetes, okay. So apart from the drug that the doctor gave him, any other drug that he take? Any multivitamin or recreational drug?
There's no other medication.
No other medication, just BP medication. But he stopped a long time ago.
Yes.
So I want to ask about his family background. Does any of his family members experience anything the same like him?
I am not sure if uh, any of his family member has this event before.
What about his father? Uh, is his father still around?
Um,
Any of
the
any of
father
his
died.
parents?
The father died at 55 years old
Oh, okay. See,
because of stroke.
died 55 because of stroke. I'm sorry to hear that. Any other family members apart from his father? No.
Uncle or um uncle uncle and father had stroke, and then elder brother have hypertension.
Okay, I see. Uh, s- so, where do you guys live?
What is it?
Where do you guys live? You
Oh,
live together?
yes, we live in Terendak.
Terendak. Together.
Yes.
Uh, with kids or just both of you?
Yes, we have 3 children.
3 children. Okay. Um, does he smoke before?
Yes, he's a smoker.
Smoker for how many long? How many years?
Since the day I met him 30 years ago.
30 years ago. Okay. Do you know how many packs per day he smoke?
I think about 20 cigarettes per day.
20 cigarettes. Um, does he drink anything?
He do not drink.
He do not drink. Okay. So I think that's all. So I'm gonna recap back what you've told me and let me know if I miss anything. Okay. So you are complaining that your husband is uh, cannot move his hand and legs, and it occurred 1 hour ago, approximately 1 hour ago. Uh, he cannot move his hand and leg, his right hands and his right leg.
You always
And
specify, just a minute. Now you already collected the history. You are going to summarize it. Can you hear me?
Yes,
All-
doctor.
Okay, in the summary, you already know it is a right-handed weakness of the upper limb and lower limb. Ah, so you can always tell weakness of the right upper limb and right lower limb. Right hand or right limb together.
Right hand and right leg.
Yeah,
Okay.
continue.
uh, so you are saying that he has weakness in his right hand and leg, and it is quite severe. And he doesn't complain anything about headache, nausea, or vomiting before. No abnormal vision, but he has. But you notice he cannot speak normally, and he seems confused. And his face look twisted, right?
Yes.
Okay, and no muscle twitching or any unconsciousness, and his family and his past medical history. uh, he did meet the doctor, and the doctor prescribed him medication for his hypertension, but he did not comply it, right?
Yes.
May I know why he did not comply to it?
Because he said he was already okay.
Or because he think he is okay? Okay. And he does not take any drug other than that. And you said his family, his father died at 55 years old because of stroke, and also his uncle and his elder brother had hypertension, and he's quite a heavy smoker, right?
Yes.
Okay. Do you have anything to add or ask?
Okay, now with this in mind, only both of you are going to talk. Anybody else will also talk. Only two of you have taken history, one like a student, one like a doctor. Other students also will take part now.
Is that a question, Doctor?
No, now only two of you are taking part. Remaining students, if they take part in any other activity here, we will have some discussion now. So with this history in the mind, uh, what is the concept that you got in the mind? Anybody else can tell? What is the idea in the mind? What is the problem going on in this patient?
Maybe stroke.
Mm, okay, you are jumping into the diagnosis. Okay, there is weakness of the limb, upper limb and lower limb, and family history is there, the stroke, and non-hypertensive and smoker, non-alcoholic. And what type of onset of the disease? Is it acute, subacute, or chronic? The onset of the disease or the symptom, is it acute onset? Are you familiar with these words, acute, subacute, and chronic?
Doctor, your voice is kind of mixed up.
Uh, can you? Is my voice mixed up?
Doctor, are
Hello?
you opening two devices in Teams?
Maybe here my computer also. Let me see.
I think if you on two devices, it's going to be an echo, so we cannot hear you that well.
Okay, wait. I'll off the computer. Now is it clear?
Yes.
Okay. I was trying to open on computer anyway. I update. Now my voice is clear.
Not so much.
Yeah, not so much.
Wait.
Maybe you can use headphones.
Yeah, I'm using phone. Now is it okay?
There's still a little bit of echo.
Mine only. I'm not talking on the computer. I'm just talking on my speaker. Now, can you hear me? Hello.
Hello, doctor. Yes, we can hear you, but it's not as clear. I think, but it's okay. We can and we try to get.
Okay, let me give some. Now you gave the summary of the problem, and the problem is it an acute problem, chronic problem, or a subacute? Are you familiar with these words? Maybe somebody else is talking there. One of the student mic is on, I think. That's why I can hear also voices. Somebody's mic. Some echoing is. Okay, what maybe I sit away from the computer.
Yes, I think you can try on your computer, doctor.
No, now I'm away from the computer. Is it okay? Is it clear? Is it clear?
Yes.
Yes, it's clear to me, Doctor.
Okay, I'll refer later on the. I should have opened on my laptop. Okay, it's okay. You continue later. We see the discussion. Continue.
I thought you were asking us a question, right, Doctor?
Yeah. So the question is, did you follow my question? The condition what you narrated now, is it an acute problem, subacute problem, or a chronic problem?
Is it acute, doctor?
Yeah, I
Yeah.
think it's
How
okay.
many hours back it started? 1 hour back. So the problem is an acute problem. Okay. So in your mind, you must see something happened. It is with a short duration we call acute. The motorcycle came, hit my leg, I broke my thigh. It's an acute problem. I'm having cough for 1 month. Productive sputum is a chronic problem. Something like that. You must use some words: acute, subacute, chronic. Remember these words. Okay. We go to your discussion first. According to your procedure, we will discuss again at the end. Continue.
So can we proceed with the video?
So now you finished your history taking and you made a summary. With this summary in the mind, what is the concept you all got? What is the idea you got? Where is the problem?
Ischemic.
Now, which part of the body is involved? Is it the nerve? Is it the brain? Or is it the limb? Is it the skin? Is it the muscle? Where is the lesion?
The
I think
nerve.
it's the brain.
The brain.
The lesion is in the brain. What do you think is the problem in the brain?
Lack of blood supply.
Okay, at least some idea you have. Let us see. Go ahead. So now you start your examination.
Okay, I'll share the screen.
Now the voice became better. Maybe one of your phone or only. Okay. Voice not clear. Can you increase the volume?
And I am a second year medical student. May I examine you?
Yes.
Okay, now I'm going to put this cotton wool and then you are going to tell me whether you feel it or not.
Okay.
This is how it feels like.
Alright.
Now, close your eyes. Do your hand like this. Okay. Yes. 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 Yes.
Hold on for a while. Hold the video for a while. Can you pause the video? Can you all hear me?
Yes,
Yeah,
I'm
doctor.
pausing the video.
Okay. So anyway, when you say examination, you must split into two parts of examination. The first part is general examination. Next is the systemic examination. Means you are going to examine what system now? Neurological system. So first, what is general examination? Any idea? Anybody has taught you what is general examination?
Yes, doctor. Where we need to generally look at the face, at the hand, at the fingers, at the nails.
Okay. So I'll give you a summary. General examination, you first cover vital signs. You can make a note. So in the clinical senses, any patient, any ward, general first, then systemic or local, whatever the part that is you are going to, which part you are thinking is involved, that is, it will become that system examination. So in general examination, if you cover vital signs, any idea on vital signs? Anybody knows what is vital sign? How many vital signs you want to know?
We have doctor. Temperature, pressure, respiratory rate, pulse rate.
Okay. Pulse, BP, respiratory rate, temperature you told. Then pain, if there is any pain, pain score. So these are the vital signs. Pulse, BP, respiration, temperature, and pain score. pain score 0, no pain, 10, severe pain. That is old visual analog scale. Anyway, all this is not given in your whatever the manual they gave, but I am adding few things for your knowledge purpose. So general examination first, and in that you cover vital signs first. Then comes now your system involved is what is the system that you are going to examine?
CNS.
In other words, upper limbs and lower limbs. So mainly, it is a weakness of the limbs that is your. In other words, it's a nervous system, but it has affected both upper limb and lower limb. The lesion is in the brain. Okay, these are the headlines. Now we see how you cover it. Okay, you show. Continue with your video. I will talk at the end of your video. Continue.
Wait, doctor, the internet is kind of slow.
Even my house also same problem here. And it is not a house, it is a transient accommodation, Airbnb.
I'll try to unshare and unshare again. Wait, doctor.
I'm going to mark you. So a list, let me check your list. This mark list has to be sent to whom? Aina? There's a list that we have to mark you. Is that
I think you have to send either to Dr. Rahima or Dr. Jahid.
I mark on the sheet which they are given. So your group is group 9. Let me check here. And mail to them, lah.
Yeah.
Can? Okay.
Yeah, doctor, I'm trying to share the screen again.
You want to share, or I'll see in the one that link you sent. Okay, share. If I want to join on my link on the computer, what is the way I can do? Better connected. Download. I have. That link, can you send it to my email? You sent only, you added me in the list. If you have a link, you can mail me that link in my email, then I can open on my computer also. Antar itu link untuk saya punya email.
So you want me to share to your email, right?
The link from where I just click and join on computer.
Okay, I'll email.
Now it's opening here.
My other group members is sharing because I cannot play.
Okay. You share the link also and continue also here.
All right, bro. We cannot hear the sound, I know.
Can you guys hear the video?
Yeah, already you have sent. Let me see here. But when you want to discuss if it is appearing on this one is better. For discussion purpose.
I know, I think you need to share again. When you want to share, you need to click the audio button.
Whose internet is working best, they can, from their computer, they can share everything.
Yes. Yes. So does it examine you? Yes. Okay, now I'm going to put this cotton wool and then you are going to tell me whether you feel it or not. Okay. This is how it feels like. Alright. Now close your eyes. Do your hand like this. Okay. Yes. 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 So does it feel the same both sides? Yes, it feels the same. Now I'm going to test for your pain sensation. So this is how it feels like. Okay, now close your eyes. Do your hand like this. Yes. 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 Does it feel the same both ways? Both sides. Yeah. It feels same. Okay. Now I'm going to test for your vibration sensation using this tuning fork. So I'll put it at the bony prominence. Can you feel it? Yes. Feel it? Yes. Okay. What about here? Yes. Okay. Can you feel it? Yes. So if she doesn't feel anything, I'll work on towards proximity. Now I'm going to test for your proprioception, or in other words, joint position sense. Okay. So give me your hand. This way is up and this way is down. Okay? So now close your eyes. Okay. Okay, hold it like this. Up. Down. Okay. Give me your other hand. Close your eyes. Up. Down. Okay.
Good morning, how are you? I'm good. Okay, I'm Aina Bardia, so I'm going to do physical examination on you today. So I need to test for your sensory function. And for the first test, I need you to close your eyes and I will put an object on your palms and you just tell me what the object that you feel. Alright? Okay, so can you please close your eyes? Alright. Can you recognize? Yes. What is it? It's a key. Alright. Thank you. Can you give me your enough? Yes. Okay. What is it? Key. Alright. Thank you. You can open your eyes. So for the next test, I need to stroke lines on your palms. So tell me what I'm writing in your palms, okay? Alright. Close your eyes. Alright. Can you feel it? Yes. Can you tell me the number that are in your palm? Number 3. Number 4. Okay. Number 5. Alright, thank you. Okay. 4. Alright. 5. 7. Okay, thank you. You can open your eyes. Alright, so we will proceed with motor examination after this. Would that be okay? Okay. Okay, thank you very much.
Okay, Assalamualaikum. My name is Iza. I'm a second year medical student in University of Cyberjaya. Can I confirm your name and age, please?
My name is Irfan and I'm 13 years old.
Okay, so Irfan, today I'm gonna perform a sensory neurological examination on you. So firstly, I'm gonna start with light touch sensation and pain sensation examination on you on both of the lower limbs. Is that okay for you?
Okay.
Okay, so So I'm gonna start with light touch examination. So I'm gonna be using this tissue. So I'm gonna be placing this tissue on parts of your legs, both of your legs. So if you feel this sensation on your legs, can you say yes for me?
Okay.
Okay. Thank you. So can I have you close your eyes for me, Irfan? Okay.
Yes. 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 Yes.
Okay, so light touch sensation on both of the lower limbs are normal. Next, I'm going to proceed with pain sensation. So I'm going to be using this stick. So I'm going to be placing this stick on parts of your lower limbs. So if you can feel this sensation, can you say yes for me, please?
Okay.
Okay, so can I have you close your eyes for me? Okay.
Yes. 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 Yes.
Okay, that's all. So you can open your eyes now. So pain sensation on both of the lower limbs are normal. Thank you, Irfan.
Okay, so today I'm going to examine your lower limb. So I'll be examining the vibration of your lower limb. So this is a tuning fork. I want you to feel the vibration of the tuning fork. Okay, alright. You feel the vibration? Yes, sir. Okay, so I'll be performing at your legs. Ensure to close your eye during the examination. Okay, please close your eyes. Do you feel any vibration? Yes. Okay, please close your eyes. Do you feel any vibration? Yes. Next, I'm gonna examine your joint position. So this will be up and this will be down. So during this examination, you need to close your eyes and tell me either it's up or not, okay? Okay? Is it up, down, up, up, down, up, down, up, up, down. Okay, sir, I'm going to do a rhombus test. So I want you to stand still, hands side of your legs, and then close your eyes. Okay, so this is a rhombus test. Rhombus test, you need to wait the patient, look at the patient for 30 seconds while they are standing still and eyes closed, and to see either there's any swaying or any unbalance or the patient wants to fall or something. If all that phenomena occurs, there's the rhombus test is positive. Okay, you may open your eyes. Thank you. Okay, Mr. Ahmad, thank you, Mr. Ahmad, for your cooperation. Stay safe. And then don't forget to send us your hand. Let's send that together. Thank you. Let me go now.
So, finished? Hello? Can you hear me?
Yes, doctor.
Yes, doctor.
Yes, doctor.
Okay, so your presentation finished, examination finished?
I think there's the motor examination pula kan?
Yeah, that's only sensory.
Hmm.
Good evening. Now I'm going to examine you. Please do straight. Okay. Please look up at the ceiling and try to raise your eyebrow. Okay. Now please smile with your teeth open. Okay. Now close your eyes and try to open it. Don't open. Okay. Now please blow lower your cheeks, and when I try to push that, don't do this. Okay, thank you.
Assalamualaikum. My name is Manis. I'm a second year medical student from University of Sriwijaya. Can I know your name and age, please?
My name is Tasneem. I'm 50 years old.
So today I'll be doing a motor examination for your upper limbs. Do you mind if I touch you? First I will inspect the both upper limbs. In this patient, the body posture is normal. In this patient, the body posture is normal. The muscle bulk is normal. There is no fasciculation and there is no involuntary movement. Next, I'll be checking the tone of the muscle. Can you make your arm fluffy for me, please? Next, I'll be checking for the strength of the muscle. Okay, first, can you do this for me? Can you stop me from pushing it down? Okay, now can you stop me from pulling it up? Okay, now can you do this? Okay, can you stop me from pushing it down in? Okay, stop me from pulling it up. So, can you open this my directions? And then can you do this? Move this my directions again. Okay, next can you do this? Move this my directions. Okay, move this my directions again. Okay. Next, I'll try to separate your fingers. You try to put them together, okay? Okay. Again, move this my directions. Okay. Now I'll try to put them together. Okay. Spread. Okay. And spread again. Okay. Next, I'll be checking for the tendon reflex. First, I'll do the biceps reflex. Can you flex your arm? Now relax. Okay. Now do the same again. Flex first, and then relax. Okay. Next, I'll be checking for the trap. Next, I'll be doing the triceps reflex. Okay. I'll be doing the triceps reflex again. Okay. Next, I'll be doing the supinator reflex. Okay. Supinator reflex again. Okay. Okay. Next, I'll be checking for the coordination. Okay. Next, I'll be checking for the coordination of the voluntary movement. Okay. Can you touch your nose and then touch my fingers? Okay, now I'll be moving my finger around and you follow me, okay? Next, I need you to flip your hands backwards and forwards as fast as you can on the other hand. Okay, can you do it on the other hand? Alright, thank you very much.
Hi, I'm Nadia. I'm a second year medical student from University of Sriwijaya. Is it okay if I examine your lower limbs today?
Okay.
So no muscle hypertrophy detected. No asymmetry in the proximal and distal limb. No involuntary movements and no fasciculations upon elicited. So now I will examine the tone of your lower limbs. Okay, so now I'm going to test your lower limb power. So can you please lift your leg? and this one. All right. So I want you to lift your leg up against my resistance. The other one. All right. So can you please push your leg against the bed? And this one. Okay. So now I'm going to test your knee. Can you please pull your legs towards yourself as hard as you can? Okay. This one. Right. So now I'm going to put some resistance against your knee and try to straighten it. Okay. And this one. Alright, examine your ankle. So I want you to pull your toes up and stop me from pushing it down. Okay, this one too. And I want you to push it against my hand. This one too.
Okay, right now I'm going to test for your lower limb. Relax. Just relax, okay? Okay. Now do like this. Okay, this is hand knee over. It is for reinforcement in case the reflex is not present. Okay. Now I'm going to do to your okay. Okay, okay. Okay, I'm going to test for Babinski sign. The normal response is the toe, it will dorsiflex. Okay, next, the other foot. Okay, now I want your right heel to touch your left knee and heel. Repeat it a few times. Okay, so now do for the other legs. Okay. Now you have to close your eyes. Wait for 20 seconds like that.
Prof, the
So
is done.
that is the end of the examination.
Yeah, that's the end of it.
Okay. So anyway, you're doing examination on a normal individual, but you should get a concept of examining a patient. Of course, it's not so easy, but you're all doing good job. So now with this, okay, I'll give some basic headlines. Whenever you examine a patient, always general first, then system. Here the system that you are going to examine is the neuro, of course it is in the brain. So you have to examine the brain and spinal cord. And what heading you are going to examine? First, higher function, then cranial nerves, then limbs. In the limbs, sensory, motor, reflexes. So under this heading, you have to cover when you all come to the hospitals and clinical side. These are the headlines of, but you made some attempts. And when you say motor, motor actually involves in the upper limb, for example, shoulder, elbow, wrist. Separately, you have to write down. And grade of a muscle 0 to 5. All that. When you say sensory, what are the parts of the sensory system? You know, what are the types of sensation you all know?
Pain, vibration,
Mm-hmm.
light touch.
Yeah. Pain,
Discrimination.
fine touch, root touch, vibration, all this under subdivision. You may have to write down all this. But you are making an attempt. At least you are starting to do all this. It is good. So sensory, motor. Motor, you have to group into upper limb and lower limb. Upper limb, shoulder, elbow, wrist. Lower limb, hip, knee, and foot or ankle, foot and ankle. So group of muscle power like that. Then finally reflexes. Before all this, I told you cranial nerves. Which are the cranial nerves involved here? In this, where is the lesion now? Which part of the nervous system is having the problem? And what type of problem is it? With this background of what you examined, what you analyzed, where is you must get an idea now. Brain. Okay, in the brain, where exactly is the lesion? What is the pathology?
Is it upper motor neuron lesion?
Okay, where exactly it is, in which part of the brain? Can you divide the brain? What are the brain parts, you know? In
Is it
general,
pre-central gyrus?
No. Cerebral, cerebellum, spinal cord, medulla oblongata. So at least 3 parts. So here, which part of the brain is involved? Is it the cerebral cortex, midbrain, medulla oblongata, or where?
Is it at the cortex?
At
the brain cortex.
Yes, it is a cerebral cortex. Okay, we come to little more anatomy later. All of you have to revise all this. Anatomy is not so easy, especially the neurology. Okay, what is happening to the brain? What is the pathology? When you say stroke or something, what is happening there?
Ischemia.
Yes. So it is a blood vessel problem. What are the blood vessel problems you all know? Under what heading you can describe a blood vessel problem?
Aneurysm, hemorrhage.
Okay.
Blood clot.
Blood vessel getting blocked, what do you call?
Thrombosis.
Yeah. Thrombosis, thromboembolism, and it can rupture and bleed also, can cause the pressure on the cortex. So here, what do you think is the problem in the cerebral cerebral cortex? Anyway, that's in pathology, you have to analyze all that. So, but the thing that is going to cause, it may be partially blocked due to a thrombus or completely obstructed, thromboembolism, or the vessel is ruptured in one place, causing some part of the brain, that is in the cerebral cortex, to die, especially affecting the motor cortex. Where is the location of motor cortex in the brain? This is basic anatomy, all should revise. Okay. Coming to next step here. Okay. So with your examination, what is the diagnosis?
Ischemic stroke.
In other words, what is the word we use for diagnosis? Can we use a better word? Anybody want to use better words? One upper limb, one lower limb is involved here. Which sided stroke and which part of the right side brain or left side? What you are saying is a right upper limb, right lower limb. So which part, right sided brain is involved or left sided brain is involved?
Left-sided.
Left
Yes.
side.
Yeah, must know the tracks. What is the track that is involved here? Pyramidal track. So you should know all that. and upper motor neuron lesion, lower motor neuron lesion. Can anybody describe what is upper motor neuron lesion?
Prof, actually we have prepared slides for that.
Oh, you
So,
have some slides. Okay.
Yeah. Ayn, can you share the screen and present to us?
So the first one is different diagnosis. There are several different diagnoses that we have listed here. Stroke, it can be also spinal cord lesion, upper motor neuron lesion, and also Bell's palsy. Along with the reasons to support and also reasons to against the differential diagnosis. And then we also have the prediction findings in physical examination for the motor and also sensory system. For the question, doctor asked upper motor neuron lesion versus the lower motor neuron lesion. Basically, the upper motor neuron will show the sign on opposite side, or on the opposite side. So if the lesion is on the right side, the sign will be shown on the opposite side, which is the left side. But for lower motor neuron lesion, the signs of the lesion will be on the same side. So if the lesion is on the right side, the signs also will be shown on the right side. For the upper motor neuron lesion, another thing is there is fasciculation is absent, and there is no muscle wasting. There is also hypertonia. There is weakness in the arm extensor and also flexor. And then when it comes to the reflex, there will be hyperreflexia, and also there will be positive Babinski if we do the test. Where for lower motor neuron lesion, there will be wasting, fasciculation, hypotonia, reduce, or also there is weakness also in the arms and also legs. For reflexia, it will be hyporeflexia, and also the Babinski will be negative. Doctor, do you want to comment on anything or?
Okay, what next you want to talk? Any other slides you have on investigation? Anybody want tell anything? What type of investigation you are going to do on this patient?
CT scan.
MRI?
You start with simple always. As a learning student, start with basic blood count. In blood, what all you want to do? Will the blood investigation helps in your investigation and management of this patient?
Maybe we can look at the lipid level.
Yes, first thing you start with a blood count. Okay, full blood count. That involving RBC, WBC, platelet count and all. Then coagulation profile, because it is important whether there is bleeding into the brain causing some hemorrhage. So for that you need to know coagulation profile. Next is in the blood, or still in the blood only, to rule out whether we have missed any diabetes. So you are going to check the blood glucose. To assess due to hypertension any damage to the kidneys, renal function tests. Okay, that is in the blood. After that, urine, of course, urine simple, albumin, sugar, microscopy. So you always start with simple things first. Straight away, don't jump into CT, MRI, arteriogram, venogram, that one, this one. You have to do that one later. Start always anytime say investigation, blood. So in blood, full blood count, coagulation profile, blood glucose. Of course, you can add cholesterol level also, or lipid profile you can call, lipid profile. Then kidney function, renal function. Apart from this, before you go and comment on the CT scan and MRI, anybody want to advise any more investigation? This is a known patient of heart problem, blood pressure. Will there be any relation between heart and the blood pressure? Can there be a condition called thromboembolism?
Yes.
So what do you do? What investigation for the heart will you do?
ECG.
Yes, you need to order an ECG. See how the rhythm, the rate, any changes, fibrillation, all those. Then next comes your higher level of investigation. So what are the other advices you want to do on imaging things?
CT scan and MRI.
Okay. Anything else? If I say there is a bleeding, middle cerebral artery, or middle meningeal artery bleeding. But these are all bit higher level for you all. But you should know there is one more thing called angiogram. Injecting a dye into the blood vessel and then taking out the radiography. That is angiogram. So anyway, these are simple things you all remember fast. One more simplest thing I'll tell you. So for a bony lesion, CT scan shows better. For soft tissue lesions, MRI shows better. Still in between blood vessels and all you want to see properly, angiograms. Okay. So this is for the simple learning first. Okay, anybody want to add anything else apart from the investigation? I think your discussion is only up to investigation. So what is the learning outcome from this one? You need to revise your basic anatomy of the brain, the pyramidal tracts, cerebral cortex, then how the tract from there to the spinal cord it comes, and what level the upper motor neuron lesion comes, what level lower motor neuron comes and the lesion comes, how to distinguish between an upper motor neuron lesion and lower motor neuron lesion. So these are all you have to revise from your basic sciences. So then anybody want to tell anything else? Any questions so far from the student side?
Doctor, why we check for the urine?
Yeah, urine. Okay, this is a known patient of what? Hypertension. Okay, hypertension for how many years? More than 4-5 years and not on a proper treatment. What are the complications of hypertension? Any idea?
Can lead to kidney problem, kidney damage.
Yeah.
Oh,
So
okay.
hypertensive nephropathy can come. Diabetes can cause nephropathy. All these things. So to rule out any other associated kidney problem, a long-standing hypertension can cause all this problem, kidney problem. Okay. Can you basic sciences? Can anybody give an example of kidney problem causing hypertension? Kidney problem causing hypertension. Basic sciences knowledge is tested here. A condition in the kidney, renal, causing hypertension. Anyone want to try?
What about glomerulonephritis?
Okay. Any more kidney condition causing hypertension? If renal artery is stenosed, what will happen?
Less GFR.
Mm-hmm.
And then when there's less GFR, less sodium being detected. And then therefore it will cause compensatory mechanism will eventually cause high blood pressure.
So there are some kidney causes for hypertension also. So when you say this is a patient with kidney, hypertension, you also need to rule out first thing any complication, or is there any primary lesion in the kidney also causing hypertension. This is in broad, you need to analyze. This is our application of your basic sciences to clinical science. It's all learning process, slowly, and you all can keep learning. Okay, anybody got any other question?
Doctor, you were supposed to give us the findings for physical examinations.
Okay, let me tell you. Or I'll mail you the whole thing. Wait, I'll read out first. Okay, I'll start from here. So, so clinical diagnosing reasoning based on the history. So this one, the patient is having right-sided hemiparesis. Now this is another word that we use for stroke, hemiplegia, hemiparesis. Paresis means incomplete. Plegia means complete. So hemiplegia is one of the words that we use. So what is the underlying pathology? There are three causes. Atherosclerotic plaque causing the problem, thromboembolic stroke, or parenchymal bleeding, that is hemorrhagic stroke. These are the three known causes. In the bleeding, it can be intraparenchymal or subarachnoid. So these are the headlines for you to understand the things. So one of these can cause the stroke. Stroke is a common man word, but medical students can use hemiplegia, hemiparesis. Okay, then we go to so in the pathology, the middle cerebral artery, which supplies the motor area, left frontal lobe, all these things can get involved. Anatomically, which blood vessel can cause this problem? So finally, your diagnosis will be right-sided hemiparesis plus his speech was altered. What do you call that word technically? The speech is altered or no talking, what do you call the word? Aphasia. Aphasia. So your provisional diagnosis of the clinical examination should be right-sided hemiparesis with aphasia. So when there is aphasia, you need to examine the hypoglossal nerve, the facial nerve. That's why in your examination, I told you must examine the cranial nerves. There may be involvement of the eye, the abducent nerve may be involved. All that also you need to evaluate. So differential diagnosis. Okay, what are the contributing factors that cause this problem? Hypertension, and also there we don't know whether you had any atrial fibrillation. There is a strong family history of hypertension and stroke, and he was not very active. Physical inactivity can also cause. Is a smoker for last 30 years can contribute to. Smoking, in what way it causes stroke? Any idea you all have? How does smoke cause stroke? What are the effect of smoke on blood vessels? You heard about TAO, thromboanginitis obliterans? Burger.
Can you repeat again that one?
TAO, thromboanginitis obliterans.
Is it
Okay.
very disease?
One more word I use, Burger phenomena, Raynaud's phenomena. You all refer to these two words. What is Burger's phenomena? What is Raynaud's phenomena? Okay, smoking can cause peripheral vascular disorders like sclerosis of the blood vessels. The diameter of the blood vessel can become narrowed. Endothelium can get altered. Then leads on to some atheroma formation. Then that can lead on to a thrombus. Thrombus migrates to the place we call thromboembolism. So there are many things behind the smoke and blood vessels. And related to smoke and orthopedic, if I am an orthopedic surgeon, I will also tell you can remember smoking delays bone healing. Means fracture healing will be delayed in a smoker. And also it predisposes for osteoporosis. Osteoporosis meaning is weak bone leads on to fracture. Anyway, when you come to history of smoking, you must remember what is the relevance in history of all these things. Then comes, okay, I think that is on the how you formulate your stroke causes, genetic predisposition, hypertension and all. Then comes differential diagnosis. Of course, it is between hemorrhagic stroke or thromboembolic stroke, but it is a stroke. That one maybe with higher level discussion for you. Then comes okay, investigation. I already told you. But the learning outcome of this is you need to revise your corticospinal tract, pyramidal tract. How this fibers from cerebral cortex goes via pons, midbrain, medulla oblongata into the cord. Corticospinal tract. Revise this tract, keep it in the mind. Also pyramidal tract. Then comes, yeah, if you revise at least one tract, then you know what is it. And among the cranial nerves that you're going to revise is the facial nerve, hypoglossal nerve, abducent nerve, and yeah, few cranial nerves also can be there in this condition. So revise your just the brief on the cranial nerves. Then anybody knows what is Horner syndrome? What is Horner syndrome?
I think Horner syndrome is compression of sympathetic trunk that will lead to parasympathetic presentations.
Yes. Stosis, meiosis, anhidrosis. Just revise that word from your books also. What is Horner syndrome? So these are the learning outcome. Anyway, I gave you more than what is given here from my clinical basic sciences. Okay. Then what else I have given here? What I should tell you people? Let me check. Where I covered all the things. I am stimulating your brain for revision of your basic sciences, how to apply to clinical sciences. Investigation is evaluation. Role of lipids in the stroke formation, you all know. If there is hypercholesterolemia, what will happen to the blood vessels?
I think the cholesterol will go into tunica intima, and then it will ingest macrophage and then will produce foam cell.
Yeah, same thing. It will get deposited in the of the blood vessel. So the lumen will become narrow. What is a healthy endothelium will get plex or deposited with some cholesterol plex leads on to thromboembolism. Same thing can happen in peripheral blood vessel, also can happen in cerebral blood vessels, can lead on to thromboembolic phenomena or sometimes rupture of the blood vessels. Okay, for blood glucose, you all know the word HbA1c.
Yes, doctor.
Revise noted. So in your blood investigation, not only blood glucose or fasting glucose, you need to assess HbA1c also. I think that is enough for you all. MRI, CT and all, I don't think you all need to know at this level. Okay. So anybody has got any other doubts and question? Hello. Any more questions from any other students?
Doctor, in our worksheet, right? They ask about list the probable underlying pathogenesis of the above problem.
List?
Yeah, the probable underlying pathogenesis of the above problem, the symptoms.
Yeah, already I described under 3 heading: thromboembolic phenomenon, thrombotic stroke, thromboembolic stroke, hemorrhagic stroke. The list of 3 probable underlying pathogenesis. Is that the question?
Okay. But I have answered the question beforehand, so I would like to ask you whether my pathogenesis is right or not. Can I?
Oh, the way you, okay, you first tell me what you want to tell.
So basically, because of the chronic stroke that the patient is having, it will cause microaneurysms of the small arteries.
Okay.
Especially in the brain.
Okay.
So it will cause hypertensive hemorrhage. So it will, and then bleeding within the brain parenchyma.
I again grouped into 3 heading. One is thrombotic stroke, means atheromatous plaque blocking the blood vessel partially. Fully embolization, embolus came from somewhere, maybe atrial fibrillation or something, then blocking the whole thing. So thromboembolism. Okay. The last one, stroke can come due to bleeding into the parenchyma. Parenchymal bleeding can be due to one of the changes in the blood vessel. It can be an aneurysm or changes, thinning of the blood vessel, chronic hypertension. Any of these things can change the blood vessel pattern and can also rupture. And then hemorrhage can cause also stroke. So there are 3 headlines under which you need to analyze: is it a thrombotic stroke, thromboembolic stroke, or hemorrhagic stroke? These are the 3 things that you need to analyze. Okay. To distinguish that, what you are going to do? So angiogram, CT, MRI, that will help. The interpretation of all that I don't think is needed for you. So you can use, for example, there's a rupture of blood vessel. How do you know? If you do an angiogram, you know, or you can see in a CT or MRI the hematoma there to distinguish. Okay. Is it clear? Anyway, this is just a beginning how to apply your basic sciences to clinical sciences. This is just so you'll be learning more when you come to higher levels, and for that you need to see the patient. Here it is a simulated patient. Just in the beginning is okay, because now you can't nobody can go into the hospitals, not see patient, and when you all come into the clinical side, you'll be able to understand much better. Actually, I like you all to history taking first and do some basic physical examination. How do you do basic clinical examination? Again, I will repeat. Start from the head to toe. In that, vital signs first. That is general examination. Systemic, because when you examine, you comment on the head, neck, chest, abdomen, upper limbs and lower limbs. Okay, because it is a nervous system that is involved in the brain. So you need to examine under sensory, motor, reflexes. So cover under these headings, then you won't make any mistakes. Before that, you also, because it's a neurological examination, you have to start with cranial nerves, pupils. I told you a few relevant nerves. So those nerve tests you have to perform. Here there is facial nerve problem, then tongue cannot talk. So you need to analyze facial nerve and also the hypoglossal nerve. Then in the eye examination, if there is any meiosis or eye diverted to one side, abducent nerve or anything, you need to analyze those nerves also. So you just revise the basic sciences, then see how you can apply to the clinical sciences. So I think is a better way to have a discussion on this topic. Anybody else want to add any more thing? Actually, are we supposed to give my literature to you all to read through, or no need to give? What is supplied to me is not supplied to you. We are supposed to give you at the end?
I think it depends on you. Like some lecturer will give.
Previous university, I used to, for year 3 students, I used to give the whole thing so that they will go through the whole literature. Anyway, I'll mail you. You WhatsApp me your email, I'll send it to you. So you can share to others.
Okay.
That you know what has been supplied to me, what is not supplied to you. It's a whole picture. Anyway, I've narrated already, but it is in the written form I'll give you. Let me make a note of your registration number. Or you WhatsApp me your list once again to me, or you mail me your group student list. When I'm marking, it won't be a mistake. I know it is group 9. Still, it will be better. You mail me your student list. You have my email? Yeah, I gave you morning.
Yeah, I have your email.
So email me. For your email, I'll send you this literature. You send me your student list.
And also the students is okay.
Yeah. I'll mail you once I get, I know your email, then I'll give you this literature to you to that email. Okay, anybody want to add anything else? Any discussion or any questions? Or want to bring out any more extra knowledge you want to highlight and then discuss? Nobody want to add any more? Nobody want to add? Okay, we can stop here. Okay, take care. Bye.
Thank you, doctor.
Welcome.
Thank you, doctor.
Welcome.
Thank you, doctor.
Thank you.